Good day, ladies. I'm here to submit to you the course titled HIV and AIDS and Other Endemic Diseases in Africa. I'll be taking the course alongside the question bar, and the credit R is 1. So we'll look at course learning outcomes. Learning outcome 1: demonstrate good knowledge and awareness of HIV and AIDS, including other endemic diseases such as diabetes, hepatitis B, and Ebola, including the COVID-19. 2. Acquire skills required to prevent the spread of such diseases. 3. Use the knowledge and skills acquired to behave responsibly in the world of HIV and AIDS and other endemic diseases. Then we begin our lecture proper. We are looking at the meaning of HIV. HIV stands for Human Immunodeficiency Virus. So I'm going to explain the individual words. Human means that the word used because the virus is mainly found in humans and not any other animals or organisms. Then immunodeficiency. The meaning is that we are looking at the lack of protection against diseases. So if your immune system becomes very deficient, is weak because of HIV, then it means your body cannot fight against other infections. Then virus simply means the germ that causes what HIV. It can be a pathogenic, can be a microorganism that you cannot see with your naked eye. So there's a video for you to, watch on how HIV and AIDS enters the body.
We explain HIV and AIDS. The human immune system defends the body against illnesses all the time. It uses guards in the blood called T cells to recognize any intruders and destroy them. But instead of attacking the body, the human immunodeficiency virus, or HIV, attacks those T cells themselves. It turns them into copy machines to make more copies of itself, then eventually kills the infected T cells. Without treatment, it takes 8 years on average for a person with HIV to develop AIDS, or acquired immunodeficiency syndrome. By then, there aren't enough T cells to fight off various infections and diseases. So it's not the virus directly, but the diseases that are eventually fatal. Humans first acquired HIV from blood contact with apes and gradually transmitted it to more people through unprotected sex, used syringes, and childbirth. AIDS remained undiscovered until a sudden outbreak among gay men in New York and San Francisco in 1981. Very quickly, people began developing the same unusual symptoms around the world. The patients suffered from rare forms of skin cancer, pneumonia, or thrush, and few survived. Prejudice against homosexuality made research funding hard to get, and more people were getting sick. What could be done? Keep the virus from spreading. It became clear that the best preventive measure was safe sex, as condoms kept the virus from infecting others. Additionally, blood banks started testing blood, and new programs even distributed clean needles to drug users. Finally, in 1987, the first treatment against the virus was released, the ancestor of combination therapy. The medication still isn't a cure, but it keeps the virus from multiplying and destroying the host's immune system. By starting treatment early, people with HIV can now live long, healthy lives. Unfortunately, many people still lack access to medication, especially in sub-Saharan Africa. Over the last 30 years, about 36 million people have died, while 2 million more are infected each year. Scientists have made a lot of progress, but are still looking for the cure. You too can help end the AIDS crisis. Play safe, get tested, donate to support research, prevention, and care, and spread the word.
So this is how the the HIV virus, looks like. So if these things are found in your body, will you become a normal person? So the HIV virus, when it enters the body, this is how it is. Then it multiplies and takes control of your entire body. There are two main types of HIV. HIV type 1 and HIV type 2. Then let's look at the behavior of HIV type 1. It occurs worldwide, so it means that HIV type 1 is found everywhere. It's here in Ghana, everywhere. More severe and also more easily transmissible. It's highly infectious. And it's the predominant type of HIV in the world. Note, HIV type 1 is more virulent, meaning it is able to replicate itself and destroy the immune system more rapidly than HIV type 2. So in your exam, if you ask why HIV type 1 is more virulent, then we are saying that it is able to multiply or replicate or mutate itself and destroy the immune system more rapidly than what HIV type 2. Then let's look at the behavior of HIV type 2. It occurs mainly in West Africa, found in Europe too, especially in Spain. It is also less severe as compared to HIV type 1 and less infectious as compared to HIV type 1. So both HIV type 1 and 2 have been identified in Ghana and other West African countries. In addition, it is possible for a person to contract both types of HIV through what we call reinfection. So if your partner is HIV positive and you still go ahead to have unprotected sexual intercourse with such an individual, then it means that you are going through what we call reinfection. So when you are reinfected, then there is no drug that can suppress the virus. So take note. What is AIDS? So we are done with HIV, then let's look at the meaning of AIDS. Acquired immunodeficiency or syndrome. So the word acquired means that you get it from somewhere, and so your own body does not make this disease. It comes from outside your body. It means that probably you have a sexual intercourse with an infected person. That's why we said it is what acquired. You've gotten this from somewhere. Immune, it refers to the body's ability to fight sickness. So everybody has some form of immunity inside his or her body. So this helps the person to fight diseases and stays healthy. Now, deficiency simply means lack of something. So a person with AIDS, the body's immune system can no longer work. It cannot fight off even the weakest disease germ. A person with AIDS therefore catches many diseases or illnesses. These diseases will eventually kill him or her. Then a syndrome simply means there are sicknesses that occur together. A person with HIV, a person with AIDS get many of the same kinds of infections and diseases such as cough, diarrhea, and shingles. The same person. Severe headache, nice with all these found in one human being. So when you are experiencing a collection of diseases, different types of diseases, it is known as what? A syndrome. Let's look at an AIDS patient. So when you are infected with HIV, this is how the vagina will look like, because the AIDS is highly interested in your genital. So it has taken over this person's genitalia. Look at the vagina. It's infected, so you can no longer enjoy the sex you normally do. You have to be very careful. Let's look at most of HIV transmission. How do we acquire it? 1. Having unprotected vaginal sexual intercourse with an infected person. So take note. Anytime you're asked to state the most of HIV transmission, take note of the keywords having unprotected sexual intercourse with an infected person. Always add the infected person. So engaging in anal intercourse, the anal, sex through anus with an infected person. Having oral sex with an infected person. Of you probably may want to lick the man's penis, or the man may also want to lick your clitoris. All these lead to some infections. receiving a transfusion of infected blood can also expose you to HIV transmission. Infected mother to child transmission. A pregnant mother with an HIV virus can pass it on to the newborn baby. Sharing intravenous needles and other sharp objects with an infected person. Engaging in any activities that allow infected semen, vaginal fluid, or blood to enter the mouth or the anus, vagina, or open cut or source. So, for instance, if you are asked mention any 3 fluids in which the virus can survive, so you can mention infected semen, you can talk of vaginal fluid, you can talk of blood, you can also talk about breast milk. All these are fluids in which the virus can survive. Let's move on. So we are looking at, in my earlier submission, I said engaging in oral sex. There are 3 main types of oral sex. So let's discuss it here. 1, where the penis is stimulated with the mouth or the tongue, the act is called fellatio. Where you put the man's penis in your mouth and lick with your tongue, that process is called what? Fellatio. And when a man also licks your clitoris or your vagina, it is called what? Cunnilingus. And when a man or a woman licks your anus, in order to entice you to reach orgasm, so that your feelings will come, in quote, that's how you normally say it. Oh, my feelings have come. So if your feelings have come, sometimes your feelings are in your anus, sometimes your feelings, they are also in your clitoris or your penis, then you try to exploit to ensure that that kind of foreplay will bring the game to a successful, end. And all these acts can lead to infections. So we also have non-key sexual modes of sexual transmitted infections or transmission. We also talk about skin piercing instrument. There are some of you who do tattoo on your breast, on your vagina, on your penis, on any of your private part. And the same instrument that is used on a jaw, the same will also be used on kojo. All these expose you to infection. We also have what we call black covenant, love verse. You cut your finger, also cut mine. We bring it closer, then we lick. If one is infected, automatically you also be infected. We also talk of blood transfusion, talk of tissue transplant, vaginal dilution or inserting. There are some of you who have been using concoction to wash your vagina. We call it vaginal dilution. Sometimes there are some of you who grind a champon, add water and Dettol to wash your vagina. So when you expose your vagina to any chemical, because the vagina itself has Zoom lions who are working every second, and these Zoom lions, they cleanse the vagina every day, every second. So if you try to bring Zoom lions from outside, they are coming to infect the vagina. So always take note that you do not insert or add any chemical or insert any chemical or whatever into your vagina until you are being told by a medical doctor. Don't just try. We also have what we call prenatal transmission. Contact with infected objects, clothing and bed linen. So here we are talking about another STI called genital herpes. If one is infected and then the fluid touches the bedspread, the bed sheet, and you sit on it, your dormitories or whatever, you're likely to be infected. That one has no cure to. It's also a viral disease. And we also have what we call open mouth kiss. And some of you can even kiss a man and then the man will go on coma, or the same thing applies to you. Proper kissing, then the person will just go on coma. An incident happened. I don't want to narrate. When we meet face to face, I will tell you what happened. Let's move on. We also talk of mother to child transmission. This is one of the modes of HIV transmission, but we are going to look at this one critically because It is a burning issue in Ghana in the global arena. So it is the main or the principal cause of HIV is in children under 5 years. Take note. And it occurs in 3 main ways. During pregnancy, it is rated 26%. During delivery, it is rated what? 60%. And then during what? Breastfeeding is what? 14%. So we are going to look at it into detail. Now, through pregnancy, how does it occur? The virus can pass through the placenta in cases of inflammation or high blood pressure. So we are saying that before a pregnant woman can pass on the virus onto the newborn baby, then it means that that particular woman is suffering from high blood pressure, or the person has a malaria parasite in the blood. So when you have malaria parasite, automatically your your pressure will go high. So if the amniotic fluid is infected, the fetus float in the HIV infected liquid, and we are saying the amniotic fluid normally surrounds the unborn baby. So if the mother is infected, automatically the child will also be infected. Then the mother's placenta can get inflamed if she suffers from malaria or high blood pressure. I've already explained that. Note, under no circumstance, take note of this one, that the child gets the blood of the mother. It is wrong. Anybody who tells you that the child normally gets the blood of the mother is wrong. The child only gets food through the umbilical cord, and food is not one of the modes of HIV transmission. There's no scientific proof that one can contract HIV through food. No. Anybody who tells you that, tell them that Prophet 1 says the person is telling a lie. This is not true. Now let's look at transmission through delivery. The child is exposed to the mother's HIV infected blood or cervico-vaginal secretion, which can enter the body of the child through lesions or mucous membrane. And also the child can get a micro-infusion or transfusion of blood through the umbilical cord. What we are saying here is that during labor, then the woman or the pregnant woman normally goes through stress. There will be some cuts, and they have to cut your vagina for the baby to come out, and through that process there may be a cut on the baby, and the blood that is oozing from the baby or the mother, if the mother is infected, automatically during delivery the child is likely to also be infected. Then the last one is through breastfeeding. Viral particles or cells infected with the HIV can pass the virus through the digestive tract to cause infection, particularly in cases where lesions are present. When we talk of lesions, they are just some blisters on your skin. And these blisters, when you touch it, they normally burst, and then some fluid normally comes out. We call it abscesses. So, and because there's a newborn baby, the digestive tract is not well developed. So during breastfeeding, because of the viral particles of the infected mother, if the child breastfeeds, then it means that automatically the child may get the virus. So therefore, HIV positive mothers are advised to practice exclusive breastfeeding rather than mixed feeding, which can cause irritation in the child digestive tract. So we are saying that if HIV positive mother dare breastfeed your baby. Then there are also transmission factors. Transmission factors of mother to child include, we have what we call mother-related factors, we also have child-related factors, and virus-related factors. Let's look at them. Mother-related factor. When HIV transmission normally depends on the viral load of the mother, of the HIV positive mother. Because when we talk of viral load, we are talking about amount of HIV in the pregnant woman or the HIV positive mother. So if it is too much, then it means that that woman stands a risk of passing on onto the the unborn baby. So STIs, we are talking about sexually transmitted infection. We are talking about gonorrhea, we are talking about chlamydia, chancroid, and the rest. And co-infections, for example, malaria, sore, and abscesses on the breast. When we talk of abscess, they are lesions. They are, some rashes on the breast which contain some fluid. Immediately you touch it, it bursts. So of the mother increases the risk of infecting the newborn baby. Let's look at and we also say that nutritional factors and low vitamin A can also expose the woman. And then there are some women who are also found of smoking, they drink alcohol, fetish, and drug abuse, all parts. And they also have what we call child-related factors, and we are talking about the genetic disposition of the fetus to the infection. And the last one is what we call viral-related. The rate of transmission depends on the virulence, that is the severity of what, of the type of the HIV the mother has. So with HIV type 1, the rate of mother-to-child transmission are from 15 to 35%. With HIV type 2, the rate are between 0 and 8%. Strategies to prevent mother-to-child transmission. 1, we have primary prevention, and the primary prevention include what we call A, B, C, and D. Abstinence, be faithful to your partner, condom use, and delay sex. And then 2, promoting free testing and counseling. That's why if you are pregnant and you go to a hospital, they test you for malaria and HIV. Antiretroviral therapy, this is a drug given to pregnant women, and then the newborn within 72 hours, and that drug is called nevirapine. Then we also have what we call stop breastfeeding the newborn. That's one of the ways in which you can prevent mother-to-child. Social support, including long-term follow-up for families affected by HIV. So in case I identify family A who have an HIV positive person, then these clinical psychologists will visit you and then sympathize with you, give you emotional support, and then encourage you. And then another way in which you can prevent mother-to-child transmission is what we call cesarean section. Then they have to perform an operation and then remove the baby safely. And the last one is what we call nutritional support. The mother must eat with a balanced diet. So continue with our discussion. Then we look at the misconceptions of HIV and AIDS. Misconception, when we talk of misconception, what is it? Something that is untrue. So they are saying that when you donate blood, it means that you also be infected with HIV, which is not true. Then giving first aid, then caring for someone who has developed AIDS is not true, you will not get it. Sleeping in the same room with an AIDS person, you will not get it, it's false. Hugging an AIDS person, all these are what misconceptions. Traveling with an AIDS person in a crowded bus, in the case of COVID-19 is true, you contracted, but with that of HIV, no. Swimming with an infected person in a pool, it is not true. AIDS is a curse from God. Though even this COVID, they are saying that it is a curse from God. Only my God can tell. One can also contract HIV through mosquito bite, which is not true. The HIV virus cannot survive on the cells of mosquitoes. And then HIV is an airborne. That doesn't mean if you sneeze like COVID-19, HIV is not like that. It's not an airborne disease. Then let's look at history of HIV. The first AIDS cases were recognized among homosexual men in the US in 1981. So the first cases that we identified was in 1981 when they realized that men who have sex with men develop some kind of multiple infections, and it was identified in the United States of America in 1981. So HIV and AIDS was first detected in Ghana in what? 1986. So 2 types of HIV have been described. We did that in my earlier submission. We have HIV type 1, HIV type 2. So let's look at both types are believed to be descendants of what? Simian immunodeficiency virus. HIV type 2 is closely related to Simian immunodeficiency virus from what we call sooty mangobi, a white-colored West African monkey. So we are saying that HIV type 2 can be traced to what? Monkeys. So we are saying that monkeys brought about what? HIV type 2, whilst chimpanzees brought about HIV type 1. And when we talk of Simian immunodeficiency virus, it is a condition found in animals, especially chimpanzees and monkeys. So when it is found in in chimpanzees and monkeys, they live normal with it, but when it entered men or infected with men, then it developed into what we call HIV. So in 1999, an HIV type 1 more closely related to what we call troglodyte, which were once common in West Central Africa, around Congo, Cameroon, thereabouts. So we are saying that HIV type 1 can be traced to chimpanzees, while HIV type 2 can be traced to what? Monkeys. Alright. Theories of origin of HIV. There are 5 main theories that talks about the origin of HIV. The hunter theory, the oral polio vaccine theory, the contaminated needle theory, the colonialism or heart of darkness theory, and then the conspiracy theory. So let's look at them one after the other. So the hunter theory, they are saying that Simian immunodeficiency virus was transferred to humans from chimpanzees when infected ones were killed and eaten. So blood from the infected chimpanzee got into the cuts and wounds of the hunters. So HIV adapted to 8 new host humans and became HIV. We are saying that in those days where hunting and gathering was our main occupation, hunting, most Africans were hunting chimpanzees and were eating monkeys. So during the catch, when they caught them, what they did was that in the process of chopping the meat, sometimes they get cut on the hunter. So the blood from the chimpanzee enters into the cuts of what? That of the hunters. And so what happened was that the SIV, which is a condition found in monkeys and chimpanzees, now mutated or transmogrified, changed into what we call HIV or type 1. You see it? And they are saying that this theory is scientifically proven. Let's look at the needle contaminated theory. Using sterilized needles to inject multiple patients in Africa. If the first was infected, the hunter, then the infection was passed on. During those days, when you go to a hospital, they use one needle, they inject you, then they use the same, they won't sterilize it, they will inject another one, so what happened was that if one of them was infected, then it means that the infection must also pass on to the other. And they are saying that this theory is also scientifically proven. Let's look at oral polio vaccine theory. Edward Hooper suggested that HIV was transmitted via chat and an oral polio vaccine given to about 1 million people in Belgium, Congo, Rwanda, Burundi in the late 1950s. Hooper's belief is that chat was growing in kidney cells taken from local chimpanzees infected with what? SIV. They're saying that when there was an polio infection outbreak in Burundi and Rwanda, and the white man decided to manufacture a drug using the kidney of infected monkeys and chimpanzees to manufacture the drug. So when that drug was administered to these people were infected, and they are saying that this theory is not scientifically proven. So we are saying that consequent termination of chat vaccine with chimps and a large number of people become infected with HIV type 1. Theory remains unproven. No trace of HIV was found in vials of chat discovered in 2001. They are saying that chat was grown in macaque monkey kidney cells. No, not permissible to HIV. Let's move on to other conditions. And they also say that hepatitis B vaccine trial among gay men, the theory is not based on any scientific evidence. Let's look at the colonialism theory. Jim Moore in 2000 suggested that the maltreatment of Africans by their colonial masters in the late 19th and early 20th century facilitated the spread of HIV, because Africans or the slaves were forced into labor camps with poor hygiene, scarce food, and extreme physical conditions. So stray chimpanzees could be extra source of food, and weakened immunity could enhance Hiv infection and adaptation to HIV type 1. And also, unsterilized needle use and patronage of prostitutes could also contribute to the spread of HIV type 1. and camps were set up around the time of the initial spread of HIV. He was saying that because most of the slaves were kept in a camp, and because there wasn't any food to feed them, local chimpanzees were given to them as source of food. And probably because these local chimpanzees and monkeys were suffering from a condition called SIV, or Simian Immunodeficiency virus, it could facilitate the spread of HIV type 1. And then the last one is what we call the conspiracy theory. People believe that HIV is man-made as part of biological warfare. So African Americans believe it was manufactured to wipe out blacks and homosexuals through smallpox inoculation program. So they also say that for HIV is man-made, and it is the brain behind the white man to wipe away or to kill all blacks, and that's why they brought about this idea of HIV. And they are saying that this theory is not scientifically well proven. So let's look at the stages of HIV infection. There are 6 main stages of HIV infection. So before you can get the HIV or acquire the virus, there are 6 stages one needs to go through. We have what we call point of infection, window period, seroconversion, asymptomatic seropositive phase, clinical illnesses insufficient for the diagnosis of AIDS, and then clinical illnesses sufficient for the diagnosis of AIDS. So before you are declared HIV positive, you need to show these 6 stages. So let's take them one after the other. When we talk about point of infection, is the point at which a person becomes infected with HIV. The person at this stage has no signs or symptoms of the virus, but can infect others. Assuming you have unprotected sexual intercourse with an AIDS patient, so within that particular period, when they subject your blood to HIV test, the results will return negative, but you can still infect others. So we call it point of infection. Then we have window period. This is the period between the point of infection and the body producing detectable antibodies to fight off the infection or the virus. So here what we are saying is that even under the window period, still you feel free, you move about, you are still healthy, but you can infect others, though you are subjected to infecting others too as well. So here the person has no signs or symptoms of the virus. The body has just started producing antibodies. Antibodies are just protein element to the virus, but it is not yet enough for detection. So therefore an HIV test examining the blood for antibodies for the HIV will return negative. So we are saying that with this one, even though the person is infected and can infect others, so it is a critical period. This period can last for 2 to 3 months or even longer. Then let's look at the third stage. We call it seroconversion. And it is not conversion, it's seroconversion. This is the point at which the body starts to produce detectable level of antibodies to the virus. So an HIV antibody test shall be positive. So some people may experience short illnesses at this point, fever, skin rashes, and others. So at this particular point, stage 3, the person, when they subject the blood to antibody test, the results will be positive. Then let's look at the 4th stage. We call it asymptomatic seropositive phase. This is the period during which an individual remains free from any illnesses associated with the virus. So positive health choices can prolong this period, which can last from several months to several years. But when we talk of positive health choices, we are talking about taking balanced diet, drinking clean water, and then also exercising your body, and also abstaining from sex. So when you are able to observe these protocols, then they can prolong your life from months to several years. Then the 5th stage is what we call clinical illnesses insufficient for the diagnosis of AIDS. This is the period during which infected individuals suffer intermittent bouts of illnesses for which they receive treatment. Signs and symptoms can include fever, diarrhea, weight loss, fatigue, night sweat, thrush, and then herpes zoster. All these are what we refer to as what is related to a complex. We call it the ACT. So the ARC or AIDS-related complex is associated with clinical illnesses insufficient for the diagnosis of AIDS. So in your exams, if you are asked, signs and symptoms can include fever or diarrhea, weight loss, fatigue, night sweat, and others are collectively known as, then we are talking about what is related to a complex. Sometimes we interchange the letters. We will say complex related is or related is complex. But the correct is what is related to a complex. So take note. The last stage is what we call clinical illnesses sufficient for the diagnosis of AIDS. This is the period during which infected persons suffer further, or the person's health, further deteriorate, get worse every day. So syndrome implies multiple illnesses. Individuals often suffer from simultaneous what we call opportunistic infections. When we talk about opportunistic infections, they are infections that occur as a result of your weakened immune system. Because your body is weak, any sickness is going to MAMPONG market to visit you. Anyone going to supermarket will visit you. And when they visit you, they don't leave, they want to stay. They will call it opportunistic infections. Then we will now look at signs and symptoms of AIDS. So in your exam, the question may be asked, what are signs and what are symptoms? So signs are the diseases detectable by a medical practitioner when you are sick. So when you go to the hospital and a medical practitioner looks at you and says, oh, you are sick, then it means we refer to it as what signs. And then symptoms are conditions of what a disease. For the symptoms, we cannot see with our naked eyes. That's why we are saying that they are conditions of what a disease. Then under HIV and AIDS, we have what we call major signs and symptoms and also minor signs. So for the major signs, they are if you have diarrhea for more than 1 month, persistent fever for more than 1 month, weight loss more than 10% of your body, and then all these are what we call major signs. Then let's look at the minor signs and symptoms. They are night sweat, persistent cough. Then we also have generalized limp and then gland enlargement, persistent weakness, attacks of shingles, and we call it herpes simplex infection. We call it anansi. And then we also call amenorrhea. Amenorrhea simply means premature cessation of menstruation in young adults. So somebody 20, 15, 30 years, the person is experiencing menopause. This is not normal. Then to diagnose someone as having AIDS, health officials use the following case definition. Take note. 2 major signs plus 1 minor sign plus a confirmed HIV antibody test is equals to what? HIV positive. And it means that you are HIV positive. Or 3 major signs plus 1 confirmed HIV antibody test is equals to what? HIV positive. Any of them, there are 3. When that happens, then we declare that you are HIV positive. Let's move on. Let's look at diabetes. Diabetes means that there is an amount of glucose or sugar in your blood, or the amount of sugar in your blood is too high. And that's why people sometimes call diabetes sugar or sweet blood. So let's look at types of diabetes. We have type 1 diabetes and then type 2 diabetes. Let's take one after the other. Signs and symptoms of diabetes. Increased thirst. Some of you drink water more than 10 times a day. And then frequent urination. You visit the washroom every time. Extreme hunger. Sometimes your hunger. You're experiencing hunger. Unexplained weight loss. And then presence of ketones in the urine. Ketones are the byproduct of the breakdown of muscle and fat. That happens when there are enough available insulin. There are no available insulin in the body. And then we also have fatigue, irritability, blurred vision, you cannot see clearly. Then slow healing sore. It's light sore, then it takes months or years for it to heal. Frequent infections such as gum or skin infection, and then vaginal infection, especially candidiasis and the rest. And then prevention strategies. So we'd like you to discuss in your groups, but because you are some of you are far away, you are all dispersed, but you can still discuss it and send the answers to me when the need arises. Let's look at Ebola, hepatitis B. Hepatitis B is caused by inflammatory infection of the liver. So when your liver becomes inflamed, it becomes so enlarged beyond the normal, we say you are suffering from hepatitis. Most of transmission. Sexual intercourse with an infected person. So in case you are hepatitis B positive, then it means that you have to abstain from sex. The moment you engage in sexual intercourse with an infected person, you will also be infected. And then sharing intravenous needles with an infected person, like the HIV, through infected person to mother-to-child transmission. We call it mother-to-child transmission. So if a woman is hepatitis B positive, you can transfer the virus to the unborn baby. Take note of that. So this is how the hepatitis B patient looks like. Your skin normally turns yellow, yellowish. So this person is infected. Or even the eyes. Your eyes start to look yellow, then you have to rush to the hospital, otherwise you die. Then let's look at signs and symptoms of hepatitis B. We have abdominal pain. Sometimes you experience abdominal cramp or pain, and then your urine becomes too dark. Then fever and joint pain, and then loss of appetite. Wake up, you don't feel like eating. All these are signs and symptoms of hepatitis B. Let's look at signs and symptoms of hepatitis B. Still, nausea and vomiting, weakness and then fatigue, then yellowing of your skin, and then the white of your eyes. Your eyes become too white, jaundice, All these are signs of hepatitis. Then prevention of hepatitis B. We have what we call hepatitis B vaccine is typically given as 3 or 4 injections over 6 months. So you cannot get hepatitis B from the vaccine. So in case they test you and you're hepatitis B negative, then they will inject you. They have a vaccine for that. So when you are injected, then they prevent you from contracting. Do not engage in unprotected sex unless you are absolutely certain your partner is not infected with hepatitis B virus or any sexual transmitted infections. And then the other one is that use a new latex or condom every time you have sex if you do not know the health status of your partner. Remember that although condoms can reduce your risk of contracting HIV, they do not eliminate the virus or the risk. So take note. Do not use illegal drugs. If you use illicit drugs, get help to stop. And if you cannot stop, use a sterile needle each time you inject illicit drugs. Never share needles. Be cautious about your body piercing and tattooing. All these are preventive measures. So let's look at the primary prevention of HIV. The primary prevention of HIV are what we call A, B, C, and D. For example, abstain from sex. So abstaining from sex altogether is the only guaranteed protection. Can you, ladies, abstain from sex? The way some of you take it as if you are taking blood tonic, you take it in the morning, in the afternoon, in the midnight, any time, be careful. Be mutually faithful. Stay faithful to one sexual partner. However, your partner must also be faithful to you and must be free of any STIs, including HIV. It may be necessary for both of you to be tested before entering into this agreement. As if it is not always possible to tell the person who has HIV or STI. Most do not have outward symptoms. Sometimes, even if you are infected, you wouldn't know. And most of you enter into a relationship and you use condom 2-3 days. The next day you say, oh, once we are in a relationship, let's stop. Then you're going raw on your RCK. Be very careful. Then consistent and correct use of condom. Use a good quality condom correctly every time to prevent STI. Be sure to use condoms even when using another family planning method. If possible, use condoms that are pre-lubricated with spermicide, or use a separate spermicide with condoms that are not already pre-lubricated. Do not share sharp or piercing instruments such as belays or needles, and then delay sex until you are mature enough to have a responsible sexual life. Universal precaution: assume that everyone is HIV positive until proven otherwise. Always put in mind that everybody has, so I have to be careful. So we'll end our lecture here. The next time we meet, we'll look at other areas. Have a blissful day, and then stay safe from COVID-19. Thank you.